Today, we're jumping into a topic that's pretty much a daily reality in medicine, but it's also wrapped up in some serious legal complexity. We're talking about off-label prescribing.
So here's the big question, right? Is it just the standard of care, something you have to do, or is it a huge medical legal risk waiting to happen? The truth is, it's kind of both. So how do you walk that line safely? Okay, let's get right into this paradox. On one hand, using a drug off-label is incredibly common, and a lot of the time it's absolutely necessary. But the moment you do, the burden of proof, the need to justify your decision, falls squarely on your shoulders. The stakes get a lot higher. So let's make sure we're all on the same page. What do we actually mean by off-label? It's simply using a medication for any reason that isn't its officially approved one. That could be a different medical condition, a different dose, a different route of administration, or for a different group of patients. And here's the absolute key takeaway. Doing this is perfectly legal. That's not the issue. The real issue is professional responsibility. The moment you go off-label, the standard of care that you're expected to provide goes up. And that means your duty to document everything carefully goes way up, too. So, how do you meet that higher standard? Well, it all boils down to one word: justification. This isn't about finding loopholes or bending the rules. It's about following a much more rigorous professional standard, one that's backed by solid evidence and really clear clinical thinking. You know, the courts and medical councils get it. They recognize there are plenty of legitimate reasons for this. Maybe there are literally no approved drugs for a condition, or maybe it's just the standard way things are done in fields like oncology or pediatrics, or hey, maybe the approved treatments just didn't work for your patient. As long as you have a solid clinical reason, you're on the right track. Legally speaking, especially in a place like India, you're not going to find a single law that says thou shalt not prescribe off-label. It doesn't exist. Instead, the practice is governed by the frameworks already in place, like NMC regulations. And what's interesting is how perfectly these legal duties line up with our core ethical principles: acting in the patient's best interest, doing no harm, and making sure the patient is fully autonomous and understands the decision. This brings us to what is, without a doubt, your most powerful tool for managing all of this risk. Let me be really clear. In any legal challenge involving off-label use, your documentation isn't just part of your defense. It is your defense, period. So, what does a truly defensible, legally sound note actually look like? Well, it stands on these 5 pillars. You need your clinical rationale, the why. You need a summary of the evidence you're relying on. You absolutely have to document that you had the informed consent discussion. Then the nitty-gritty prescription details. And finally, a clear plan for monitoring the patient. Honestly, think of this checklist as your legal shield. Now let's zoom in on that third pillar because it's huge. Informed consent for off-label use is so much more than just getting a signature on a piece of paper. It needs to be a real, structured, and totally transparent conversation with your patient. This is about building trust just as much as it is about fulfilling a legal duty. And that conversation should really hit on 6 key points. You've got to tell them what the drug is actually approved for. Then, explain exactly why you think it's the right choice for them. Mention the evidence you're leaning on. Be upfront about all the risks and uncertainties. Talk about the alternatives. And finally, lay out your plan for monitoring them. In this conversation, clarity is absolutely everything. Okay, so we've covered what you should do, but knowing what to avoid is just as critical. So let's flip this around and look at the common mistakes that can get you into some serious trouble. Just look at this comparison. I mean, the difference is night and day, right? On the left, you have started drug X, will review. That's so vague it's basically useless in a legal setting. But the note on the right? It's a fortress. It lays out the rationale, the evidence, the consent, everything. Which note would you rather have in your patient's file? It's a no-brainer. These right here are the big red flags. These are the behaviors that get criticized again and again in legal cases. Using an off-label drug first line without a really good reason. Forgetting to even tell the patient it's off-label. Just taking a pharma rep's word for it. Writing those vague, lazy notes. Or not having a clear follow-up plan. You have to avoid these. And here's a crucial point for everyone, but especially for doctors practicing within the Indian legal system. With the country's strict consumer laws, a case is not going to be decided by what you meant to do or what you remember saying. It will be decided by what is written down. Your documentation is what wins or loses the case. So when you bring it all together, what's the bottom line?
It's this. When you do it right, with solid justification, crystal clear communication, and meticulous documentation, off-label prescribing isn't some scary risk you have to avoid. It becomes a powerful clinical tool that ultimately protects your patient's outcome and, at the very same time, protects you.